is working to move progressive reforms at the state level. I'm going to be making a few important announcements and introductions before we get to the panel discussion. But I want to go on a slight tangent that does have some relevance. Today, as many of you know, Governor Ritter declared it Purple Tuesday. And I think I might be remiss without giving a shout out to the Colorado Rockies, as it is a good time to be a hometown baseball fan here in Colorado.
We have one fan.
And I bring this up not only because I'm sure it's a great source of pride for many of you, but also because there are some interesting implications for healthcare here in Colorado, particularly if the Rockies win the big dance. There have been several studies that have shown that while hometown teams have been winning, visits to hospital emergency rooms have decreased. In 2004, when the Boston Red Sox were on their march to the World Series, the games that they were winning, there was a 15% decrease in visits to hospital emergency rooms. Now, a 15% decrease. Now, of course, the inverse is true, in that after the game, there was another study that showed that after major sporting events, and in this case it was football games, and it was a hospital in Baltimore, and it was college Division I football games. Among men, in the 2 to 3 hours after the football game, there was a 75% increase in visits to the hospital emergency rooms. They didn't quite go into the reasons for the visits: too many nachos, some imbibing, or the heartache if your team loses after being up 2 touchdowns in the fourth quarter. So, for whatever that's worth, there are some implications for the Rockies' recent success for the healthcare and healthcare reform here in Colorado. So we wish them luck and you luck as they proceed to the World Series. Now I just want to, I'm going to be introducing the panel in a minute, but before we get to that, after the panel makes their presentations, we will be asking for questions and comments from you in the audience. And we just have a few ground rules that we wanted to throw out there at the beginning. First, please introduce yourself and your organization if you're representing one. 2, please keep your question or your comment to under a minute as much as possible. And 3, if you have multiple questions, we would ask that you start with your first question and then let other people ask a question, as we expect there will be many questions or comments. And if you have a comment that you don't want to share with everyone here in the room, there are some sheets at the sign-in table where you can offer a comment or ask another question that will be addressed by Representative Carroll and others in the room. So I am very pleased to introduce the panelists today. First, someone who doesn't need an introduction, but she will get one anyway, is State Representative Morgan Carroll, who represents District 36. Morgan was first elected in 2004 and has quickly established herself as a strong leader in the legislature and as a healthcare advocate. She was recently elected by her colleagues as the Majority Caucus Chair of the House Democrats, and she serves on many important committees, including the Judiciary Committee, where